Well, Danny, we've talked in the past about the shortcomings of American education and how too few Latinos are graduating high school and college. That's part of this conversation, whether or not this community misses the boat on this new industry, which is creating jobs.
It very much is, and to your point earlier, health IT, for example, really is shovel-ready at this point. One of the other hats that I wear is I'm on the Virginia Workforce Council, and I want to commend the Workforce Council and the community college system, not only in Virginia but throughout the country, for focusing on this particular aspect of the industry. Is it healthcare? Is it IT? No, it's a specialization. And it takes everything from the very high-end research and development activities that we've seen in the report to folks that are able to go in with a high school diploma, with an associate's degree, and actually have a direct impact on what's taking place on the ground in communities, in primary care offices, in hospitals. And these are training programs that are being rolled out through the community college systems into the high schools, even in many cases, to be able to bring young people, particularly young people from underserved communities, into the system, give them the training, the education that they need to make an impact. HIMSS, for example, the organization that I'm working with now, has done quite a bit to be able to bring together workforce development and outreach into communities in a way that's impactful and focused and targeted. We've got a program underway right now where we're working with Quest Diagnostics and the Office of Minority Health to be able to develop a program in Houston specifically to help 75 or 80 providers adopt health IT, giving them the tools and resources and financial aid to be able to do that. And that's going to involve a lot of folks going through a lot of training and creating jobs to support those systems and actually create healthier communities in the Houston area. So these are real impactful on-the-ground programs.
Dr. Rios, there's already a lot of Latinos in the healthcare industry, but their intake, orderlies, cleaners, phlebotomists, they do a lot of the low-level, low entry-level jobs. Once you're already in, is it possible to get the subsequent training you need to prepare for these new jobs that are opening up?
Oh, definitely. And let me just say, for the record here, Latinos are very much needed in the health industry at all levels. But we know how much it takes to get to be a doctor or a dentist. You know, the professional level takes 10 years, 15 years to get there, and you have to look at, the mindset has to be about investing in your future. But we have so few, let me just say for the professionals, out of all the doctors in the country, only 5% are Hispanic or Latino. Out of the nurses, only 2%. So we have tremendous need for Latinos to get into health professions. But we also know that not everybody has the ability to stay in school, and we have families and other obligations, and to get a job that's a good paying job. Health industry tends to be a little higher paying than other industries, and there's a lot of career movement within different systems as they're being built, from the medical offices to the hospitals, and including clinics now in the training arena. I think that we've always, as a National Hispanic Medical Association, wanted more young people to think about healthcare and to help us with the next generation in our country to have the Latino face at all levels in health. And especially with this new emergence of jobs that are for the community college level and entry level type positions. Like you said, the people that are already in the health industry, they understand how to work in hospitals and who's who and chain of command and all of that within these different places. It would be excellent for them to consider applying for these types of jobs that are going to be increasing by leaps and bounds.
So if you're willing to take the hit, night school and weekends and that kind of thing, there's a possibility for you to move into what? Should we call them the white-collar ranks, Sharon Baskerville?
Well, you know, I think that a lot of workforce development looks at creating career ladders. So, I mean, the community college is a perfect opportunity to come in, and these technology pieces, the sort of assisters and extenders in hospitals or even primary care settings that are going to become more and more. I mean, my folks say to me, get me people who are computer savvy, you know, on the front end, even before when you might get a job as a receptionist or a clerk. the level that you're going to have to be able to step up to, because the data that gets entered is critical for this system. But just the exposure and the ability to get a job that's going to pay far more than what you might be able to get really is that confidence booster and resource builder that says, maybe I will go to nursing school, maybe I'll become a nurse practitioner, maybe I will go to medical school, because the success rate is much higher to enter a technology career. And it really is being marketed. I think people need to be careful for those scams of certain schools that charge you a lot of money to come in before you're really sure what it's about. It is, your community college is your best bet, because they also receive significant funding from the Office of the National Coordinator to develop these technology tools.